Welcome to Healthy Living. Today we're going to be talking about the importance of having a primary care physician to kind of manage your care, to be your quarterback in your healthcare game and your journey. So I have two very special primary care physicians with me today from our own St. Tammany Health System. I have Dr. Helaire. She is a family medicine doctor, and she works at our Folsom Clinic, the St. Tammany Physicians Network clinic in Folsom. So welcome. Thank you for coming today.
Thank you for having me.
Yeah, and welcome back, I should say, because you've joined me on several occasions, and I really appreciate your time. So you are a little bit new to St. Tammany Health System. It's been about a year now, correct?
Almost a year.
Yeah. Okay. So we're coming up on that anniversary. So just tell people a little bit about yourself and what inspired you to become a doctor.
Okay. So I'm originally from Natchitoches, Louisiana. I'm the daughter of wonderful parents. They're deceased now, but they introduced me to medicine. They drove medical transportation, so I was exposed to so many different people. I was exposed to hospitals, staff, and one thing that I remember that really intrigued me was that they had two children that were on the transportation van, and they were wrapped. And I said, "Mama, why are the mummies on the van?" And so at that time, my mom said they were burn victims. And I said, "Burn victims?" And I was like, "Well," I said, "So what happens next?" And so she started walking into the hospital, you know, kind of showing me around the hospital, from the staff at the door to the kitchen staff to the doctors, nurses, just talking to many people, get me exposed as possible because I was so interested. And then from there, of course, you know, you go through primary school, secondary school, but I worked with a pediatrician. I thought I was going to be a baby doctor.
Okay.
Before going into med school and kind of finding my way. So after graduating after going to Xavier and then getting into med school at LSU New Orleans and getting my public health and MD, I did a part of my residency. I had a compassionate reassignment because my mom was in the hospital. That's when I got really interested in how the heart functions. So she had heart failure due to chemotherapy.
Okay.
And after that, I transitioned into the military, and that's when I really figured out family medicine was for me.
Okay.
I like the well-roundedness of family medicine. And then after that, residency for LSU Bogalusa and then St. Tammany.
All right.
And so I'm happy. I love rural medicine. I'm a rural girl. I always tell people I'm a country girl at heart, but I do love the city and shopping. So that's me.
That's a balance. That's a good balance. I like it. So when you talk about family medicine and primary care and why it's so important, because you did talk about the little aspects of medicine that you saw, but then it all came together for you, right? Much like it comes together for the patient when they're talking about their own healthcare journey. And we do want to talk a lot about women and women of childbearing age and the importance of women having a primary care physician, but really it applies to everyone. Mm-hmm. And we kind of want to differentiate. A specialist is one thing, but your primary care doctor, you know, we're in football season, it's kind of cheesy, but we like to say you're the quarterback, right? Quarterback of the team. So tell me why that's important. What does that mean for especially a woman of childbearing age, whether they're planning a family right now or not?
So the quarterback analogy is actually perfect because it allows us to be at the center of everything. Although we can refer to specialists or secure message specialists about things that we need further evaluation on, we can bring it back full circle because everybody doesn't take care of the full patient completely. You might have a gynecologist or an obstetric doctor. You might have a cardiologist that's on the team or endocrinologist, but we bring all that back together to make sure the patient is fully being taken care of, properly reviewing medications, making sure we're taking care of that preventative health full circle, addressing any other like psychological things too. So it's a balance. We try to keep the patient balanced all around. It brings the patient back for wholeheartedly. So with primary care, it allows us to see them and do early detection of health diseases and illnesses and things like that through initial history and physical exam, just that simple. Knowing their history, knowing their social history, like of smoking, alcohol use, any history of drug use, you know, knowing their family history, or where do you work? Do you have any environmental exposures?
Yeah.
Medications they're taking, we review those things. We get lab work done, and it starts a little basic initially, just to get an idea of what's going on with the patient. There might be some imaging involved depending on what's going on, but it starts there too. And for women, we also do preconception counseling, because as you know, you start this early when a young woman starts to have her cycle. You know, you want them to understand what's a cycle, and that having a cycle puts you at a higher risk of getting pregnant now, right?
Right.
Because your body's preparing every month to have a baby,
right,
for implantation of an egg. And so just starting at any visit you can do it. It's not one visit, it's not every visit, but at any visit you can have these conversations. You can say, hey, are you even interested in having children? Are you interested in contraceptives? Or are you having problems conceiving? Do we need to get a specialist involved? So we are there to like quarterback and get the ball where it needs to go.
Right. And so when you talk about all those kind of tests and early detection, because we like to say at St. Tammany Health System, educate, screen, prevent.
Right.
So what are some of those screening opportunities you can offer as a primary care physician that maybe a specialist could also, but if you come to your primary care, you can start with you.
Especially in rural medicine, accessibility is really important to our community. So we can, for our patients before the age of 21, even do pelvic exams, even breast exams, because some people may come in breast tenderness or breast abnormalities, or hey, I'm having some abnormal discharge, or my urine smells a little funny. So we can do a pelvic exam, and that's simply just taking a look. And then as they progress and get a little bit older, we start going into cervical cancer screenings. And those start at the age of 21, whether you're sexually active or not. And it's called a Pap exam, where we get a little sample of the cervix to see if there's any cancerous tissue or any tissue that can progress to cancerous tissue. And from 21 to 29, we do that. We don't do any HPV testing because that population normally can clear HPV during that time.
Okay.
But there can be additional monitoring and testing done. And then 30 to 65, we still do PAPs, but we add the HPV co-testing because the risk is a little bit higher and there's less chance of clearing. We can also do breast exams, and if you want that done, but breast cancer screening starts at age 40.
Okay.
And it can be earlier if you have a family history of someone that was detected a little bit early. Sometimes they say 10 years before.
And that's part of that counseling and coaching that you recommend.
Correct. So we kind of go through and we always educate them each appointment. Hey, tell us what's going on. This is a safe environment for you to be honest with us, because that's the best way for us to assist you and help you. It's not a judgmental environment. We're there to keep you the healthiest you can be.
Yes.
Especially when you think about women who want to have children. So let's keep you at a healthy weight. Let's make sure you're not on medication that can affect the baby if you're planning on having a baby. We start talking about then what's the family planning idea? Is husband on board?
Right.
Has husband been checked if you've been having trouble? Things like that. We kind of go on. What are your chronic conditions? Is your blood pressure controlled? Your diabetes controlled? You have thyroid disease? Maybe we need to up your medication dose. If once you conceive, and are there like things like that we can stay abreast of? Or you're on seizure medications? Do we need to transition that medication to something that's not teratogenic to baby, that things that harm baby? Or you're on folic acid to prevent neural tube defects? Like, what are you doing? Are we having a good multivitamin?
Yeah. So all of that is like preparing women especially for what may come in their future. And I want to touch on something, because you are really good at putting this, to me, you have a really good outlook on this. It's very important to be honest with your primary care physician, and then when you establish that relationship, it's a lifelong relationship.
Correct.
And people tell you things. They might tell you the truth, they might not.
Right.
But we encourage people to tell the truth to their primary care. And I like your approach when I've talked to you about this before, and you say, oh, somebody tells me I drink 18 beers, a day, and then what is your answer to that?
Sometimes I say, no, you're not supposed to drink 18 beers per day. And they laugh because they really do know that a lot of people know that they have a problem. And that's okay. And I tell them, it's just like somebody who eats too much candy, who eats too much food. But we can start. I say, let's reduce it by half, or let's reduce it by a third. I don't say, hey, just stop. You're a terrible person. I don't do that.
Right.
Because you have to be realistic in the management of a patient. Let's work together and get a reduction. And let's get to the root of the problem. Hey, tell me a little bit about what's going on. When did you start that habit? And so I ask those type of questions to get their rapport going. And sometimes I say, okay, with this, I want to see you back a little bit sooner. Let's do 2 weeks here and then 2 weeks again. And then we can kind of establish a rapport and say, how are we doing? And sometimes I say, hey, I did good last week, but then my brother came in or my sister came in. And I say, I can understand that we like to get together, laugh, and have fun. But as long as you're doing it in moderation. So I just remind them that we're human. We all mess up. I mess up. I tell people all the time, sometimes that ice cream bowl is too big, but it's my ice cream and I want it.
Right.
So, so we do, we're all human. And that's what I tell them. I said, so don't think that we don't mess up too.
Right.
We're right in the same boat.
So that primary care relationship, we kind of talked about if you're not ready to have a baby, you have that preconception counseling. You do a lot of things on the front end if a woman tells you, yes, I am interested in planning a family. Right. But then, you're looking beyond that too. You're looking at the whole outcome for the rest of that person's life. You're looking far ahead for their, and your issue spotting. So tell me about some of the issues you might look for to ensure that a woman has a healthy pregnancy.
So some of the things that we talk about, one, as I told you, just start basic, getting a history, finding out if they have any things that can prevent them from having a healthy pregnancy, like smoking, alcohol use. What's their weight? Do you have a healthy weight? Because sometimes we can be too low in weight or we can be too high in weight, and you want to make sure the baby has good nutrients and everything. We talk about screening for sexually transmitted diseases too, to decrease the risk of passing that to the child, because they can end up with different types of diseases and maybe affecting their vision and hearing and things like that. We talk about appropriate immunizations like Hep B, MMRV, Tdap, because kids' pertussis was on the rise, in the recent years. So we want to make sure they're covering the kids too. So we try to get like a full picture of making sure they're healthy and making sure they know, like, hey, is it a year or 2 years? Do you need contraceptives until you decide to be pregnant? Hey, when you decide or when you start conceiving, let's transition those blood pressure medications to something that doesn't affect the baby. Let's transition those diabetes medications to something. So we talk about all those things. And then a new topic is people having bariatric surgery. We want to make sure they're not getting pregnant while they're having a rapid weight loss. We want them to be at a steady weight, to have a healthy pregnancy. So kind of delving into those things because, you want to address if they're having fertility concerns or not. So you want to keep it full circle. So I always start from the basics. Hey, having a conversation like we're having,
right,
and then kind of progress on to the their history, their medication management, their screenings, all those things. So
okay, well, I appreciate you once again coming in and talking to us about this. I love the way you frame things for folks, and I think people appreciate that. Is there anything else you want to add about this topic or what you do in general, anything at all before we wrap up with you?
I want to say that regular checkups are important. I know some of us think we're very healthy, but sometimes our normal is not normal. Okay. So come and see us. Come and see us in Folsom, come and see us in Covington, come and see us in Madisonville. Make an appointment. Even if you feel uncomfortable, just come talk to us. Give us a chance to take care of you and your family.
Okay. Well, thank you once again for being here with us. And we are coming right back, and we will talk more about primary care in your healthcare journey.